Topic, we will be learning about anatomy physiology of the pancreas. We will also be discussing specific on what is pancreatitis, how and what causes pancreatitis, and we will be dealing with signs and symptoms of pancreatitis as well as we will look into diagnosis and treatment of pancreatitis. So let's begin with the short review on anatomy and physiology of pancreatitis. So pancreas is a part of digestive system. So in this figure, you can see the different parts that are involved in digestion. So here you can see there's a pancreas over here, over my cursor here. So the pancreas is a leaf-shaped organ located behind the stomach in the loop of small intestine, or which is duodenum. Here, um, pancreas is usually 15.5 centimeter long. So here in this figure, you can have a better understanding, visualization of pancreas. So this is duodenum here. So pancreas overlies, or it is situated on the C curvature of duodenum over here. So this is the head of the pancreas, and it extends along all this area. This is pancreas. So you can see pancreatic duct which runs in the middle of the pancreas. This is common bile duct, and here this portion of where it joins the duodenum is called splinter of Oddi. So these are the acinar cell, and these islets, or the one in blue color, these are pancreatic islets, which are also known as islets of Langerhans. So as we go further, we will be discussing on acinar cell and Langerhans cells. So again, the pancreas plays very important role in digestion. The duodenum receives the very important enzymes from the liver and pancreas. From liver, we get the bile, while from pancreas, we receive pancreatic juice. So here, pancreas has both exocrine and endocrine role. As we discussed in figure earlier, these acinar cells present in the pancreas, which are responsible for production and transport of enzyme to the duodenum. So what does this acinar cell produce? They produce lipase, amylase, and protease, which are carried to duodenum to help in the process of digestion. So remember here, when these cells are affected with some injuries, so their failure to deliver these enzymes to the duodenum brings the consequences of having pancreatitis. So whereas the islets of Langerhans, they are responsible for insulin and glucagon production, directly uh, which directly uh, stream into bloodline. So again here, pancreatic juice contain enzymes like lipase, amylase, and protease. So lipase is responsible for breaking down of fat into fatty acids, whereas amylase breaks down carbohydrate to glucose, and protease breaks down the protein. This is an inflammation of the pancreas resulting from the autodigestion of its tissue. So when we talk about autodigestion of the tissue, here we are referring when the tissue within the pancreas start to get destructive with the enzyme produced within pancreas. This is known as autodigestion. We will be discussing more on autodigestion in the following slides. Pancreatitis, it may be present in acute or chronic form. However, acute pancreatitis is considered as medical emergency. So here, let's talk about autodigestion and how it is caused. So when uh, there is a premature activation of the proenzyme within the pancreas, um, it the zygome, which is proenzyme, come in contact with fructase. Now this gives activation to the trypsinogen to convert into trypsin. So as a result, when trypsin are activated, the other enzymes in the pancreas get activated, like activated trypsin, fructase, amylase, and lipase within the pancreas digest the pancreatic tissue. Here, so when these enzymes get activated, now they start to eat or digest its own pancreatic tissue. This will result in massive inflammation or bleed within the pancreas. And this condition now we refer as pancreatitis. So again here, the pathophysiology of pancreatitis. Here, the major factor participating are alcohol consumption or abuse of alcohol intake, biliary tract obstruction. This we are referring with the gallstone, and other conditions such as cancer or mumps virus are responsible for the activation of pancreatic enzymes within the pancreatic duct. Let's recall on the physiology when the acinar cell are cause assault most commonly with alcohol consumption or abuse of alcohol intake or obstruction due to gallbladder. These are the major factor which help in pre-activation of the pancreatic enzyme. So once these trypsin, peptidase, elastase, amylase, and lipase get activated within the pancreas, when they are not transported to the duodenum for the digestion process, these enzymes start undergo autodigestion and they start eating up its own pancreatic tissue. This result in tissue necrosis, severe inflammation of the pancreas. Now, this condition is known as acute pancreatitis. So, following that, when this acute pancreatitis further enhanced or when it goes to the chronic form, we can see patients who might present with shock, disseminated intravascular coagulopathy. This is one of the serious medical conditions such as adult respiratory syndrome. People even can present with severe pain, hemorrhage, shock, peritonitis, hypovolemic shock um, with advance in acute pancreatitis. So most common cause of pancreatitis, as we said earlier, gallstone are the most common cause of pancreatitis, um, which usually encountered um, in daily practice. Around 30 to 60% of pancreatitis are from gallstone. And abuse of alcohol intake is another most um, important factor for acute pancreatitis. However, there are other um, causes of pancreatitis, such as post-ERCP, trauma, post-operative, or even drug-induced. Let's move on to the most common signs and symptoms of pancreatitis. The most common symptoms and sign with pancreatitis is epigastric pain, as with the location where the pancreas are situated. It is on the epigastric region, so there they encounter with severe epigastric pain, which sometimes radiate to the back as well, towards the flank area. Other associated signs and symptoms with pancreatitis are nausea, vomiting, diarrhea, and loss of appetite. People might even present with fever and chills, usually when there is now bacterial invasion um, caused by inflammation within the pancreas. They usually present with fever and chills. And hemodynamic instability, which might include shock, is the another condition. um, People present with signs and symptoms of pancreatitis. So when we talk about usually can be seen in severe form of pancreatitis are a Gray Turner sign. This is hemorrhagic discoloration of the flank. There is a picture presentation on the next slide. Uh, the other condition is Cullen sign. This is the hemorrhagic discoloration around the umbilicus. Here in this picture, this bluish discoloration or the reddish discoloration on the flank area. This is a Gray Turner's sign. This is the hemorrhagic collection within the region of the pancreas. Here, this is Cullen sign, discoloration, hemorrhagic discoloration of the umbilicus region. So here in pancreas, when it has hemorrhagic insult inside, this might present in this kind of sign. So looking to the diagnostic test for pancreatitis. So usually there is a serum studies of elevated amylase or lipase, um, and in laboratory, we do the complete blood count to look for increase in WBC count, leukocytosis within the neutrophilia that is mostly related with inflammation within the cells. So the other diagnostic test usually requested is blood sugar and imaging test like abdominal X-ray, ultrasound to rule out if there are stone in biliary tract disease. So this is where we have been talking about the gallstone. So sometime when there are stones from the gallbladder that goes into the biliary tract, it obstructs the flow of the bile and the pancreatic disease, which can cause pancreatitis. So during ultrasound, we usually try to look if there are any obstruction caused by gallstone. So most definitive diagnosis for um, acute pancreatitis is abdominal CT scan. This may reveal the phlegmon, which is the inflammatory mass um, surrounding the pancreas. So in treatment, we usually put the patient in NPO, which means nothing for ORM, um, and um, people who suffer pancreatitis from excessive alcohol intake, um, are rehydrated with fluid electrolyte through intravenous uh, fluid. And pain management is usually done with analgesic. So S2 blockers and proton pump inhibitors are usually used for the control of gastric secretion. And antibiotics is often used when there is a suspicion of bacterial invasion. That's all. Thank you.